So this is my case study on my student from my 6 to 12 classroom. He is currently in my homeroom, but I am his science and social studies teacher this year, as well as homeroom and same science and social studies last year. And we will dive into a little bit of what this looks like and all of the different features that are incorporated into his plan. So who is he? My student is a 12-year-old boy. He's going to be 13 in December. He is in 7th grade. And as I've stated, he had him the last 2 years. So I know him pretty well, know his mom, know a lot about him and the family, which have been able to help me work with him and develop different strategies and plans that get coordinated between school and home. He has autism, ADHD, and mixed receptive expressive language disorder. The primary diagnosis is autism. That is a disorder that can present itself differently from person to person. Typically, this person has challenges in regards to communication, repetitive or rigid behaviors, or social skills. These can be seen in a variety of different ways, which really speak for themselves when it comes to development and implementation of various plans. 1 in 36 children across the U.S. are diagnosed with this, and diagnosis usually happens around age 5. This is according to Autism Speaks. However, earlier diagnosis before school age really can assist student or kids and families with therapy, intensive ABA therapy that allows them to develop really kind of like necessary skills in regards to some of those things that they may learn or need to know by the time that they get to school age that they wouldn't have had the opportunity to practice or be exposed to if they weren't in therapy. So due to the wide variability in the presentation of symptoms, individuals on the spectrum can have different communication needs. For one example, this can be nonverbal, limited verbal. With ASD, they need assistance in finding appropriate and effective avenues of communication. So this really speaks to the low tech, high tech, or no tech AAC communication devices and how students can communicate through a variety of user devices, applications, or even pictures and phrases and word boards. The same can go for behavior, academic, self-help, and social skills. So like I said, students are typically in intensive therapy and have a wide range of supports, both in therapy and once they've entered school. Some students do continue to need support for all of those categories. So behavior, academic, self-help, social, communication, and those behavior therapies and supports as well once they get to the school age. So really a lot of the supports can be from many angles. So in regards to assistive technology, I found this quote and I really liked it. So I just put it right in, and it says, assistive technology is any item, piece of equipment, software program, or product system that is used to increase, maintain, or improve the functional capabilities of persons with disabilities. I like this because when I hear assistive technology, my brain can sometimes jump to like an electronic, some type of device, but really assistive technology can be those pieces that are pictures laminated on a key ring or communication boards, things like that. They do not need to be necessarily electronic based. So my student has a visual schedule. It's set up with checkboxes. The schedule is really simple. There are words that list his schedule throughout the day on one side, and on the opposite side it's an empty box where he'll either receive a smiley face or a frowny face for meeting expectations during that class period. Expectations are listed on the back for reference. So if he's having a particularly hard day, he can be referred to the back and reminded what he needs to do to get a smiley face. This also allows him to see how many smiley faces he's gotten or frowny faces, because after he receives 5 of 7, he's able to get, we call it cash out for, a Hot Wheel car is what he likes to cash out for. So this kind of also helps him to self-monitor his ability to meet those expectations throughout the day. He does another feature on our chat program, or I'm sorry, on our Securely program that does have a chat component. So I can, from my device, from my computer, go in and monitor what the students are doing, but I can also initiate a one-to-one chat that allows me to communicate with him. And he does a lot of scripting, so this chat feature really gets me a lot more information and details in regards to his thinking or needs that let me better support him. So I'm also able to provide prompting and redirection in a more discreet way. I'm not yelling Jackson across the room, or whatever he may need to make sure that he's on the correct tab or staying on task and things like that. So it allows more effective communication from both myself and for him. And again, providing those details and information that I might not necessarily get from him while he is scripting, kind of in that verbal communication piece. Different behaviors that I see from him. Again, autism is a spectrum, so this may look different from another student in my classroom who has autism, but specifically for him, we see a lot of rigidity. He likes to follow routine, struggles with changes, so moving seats for him is a big deal, or when it's time to transition away from putting toys away, things like that. So when a calming time is over and the Legos are done, that can be a struggle. He does have an elopement history, has not done so in the last year, but it has been a significant concern that he is not allowed to go to the bathroom by himself or sit near the door because of those concerns. Scripting is another one. He can fixate on interests of Hot Wheels, cars, and Halo. He'll repeat phrases and facts, and often that will be his answer to questions. Hiding is also, when it gets too loud, he will hide in the corner of the classroom. Different strategies that we've worked on are noise canceling headphones, so he'll use them pretty independently. He will need reminders some days. We're working on him becoming an advocate for himself and not relying on a teacher or para prompt. That visual schedule piece we've already talked about, and breaks can go along with the headphones. The breaks are something that I'm incorporating in the room in the morning and twice in the afternoon, but we're also working on him independently requesting breaks as needed. So walking breaks, just sitting in the hallway, getting away from those loud noises as needed, and the chat feature we've already discussed as well. All of these strategies together seem to be pretty effective. It's just that we need to work on Jackson's consistency. So in regards to the headphones, like I said, he needs some prompting sometimes to use them or to get them, and even initiate that he needs a break, instead of waiting for us to ask if he needs one, if the headphones that we notice aren't working. The visual schedule can be pretty easy to leave behind, so working on maybe transitioning to an electronic version might be a little bit more helpful and efficient for him to use this consistently. So I would say between the chat and the visual schedule and the headphones, those are probably our most successful interventions at this point. Breaks, again, are pretty new because we used to be so concerned about the elopement piece that necessarily we would try to have those breaks in the classroom, but now we're working on transitioning to those outside and getting away from some of those noises or stressors as needed. With other students, I would use them because they are really able to be individualized as needed. So conversations and purposes for chatting might vary. I'm able to switch those up as best fits each student. The type of breaks a student might need and benefit from also vary. So that can be having a head down or using a fidget or walking. Any type of break really can be effective with a student. Headphones are pretty universal and used by a lot of the kids in my classroom, And the visual schedules also are pretty universal as well. There's many students who use them, and they have different purposes, whether it's academic, behavioral, or some students have one for the half day, morning half of the day, and then it's reset for the afternoon. Some of them use the whole day schedule right away. So yes, I do use these strategies with other students, but in ways that are most effective and individualized to support their needs. These are some of those references that I've used that provided a lot of great information on what we've talked about. Thanks.